Hey, everybody. Welcome back to another episode of the Horse Geeks podcast, where we look at horses and riding from the inside out. I'm Kirsten Nelson, professional horse trainer, and with me is my co-host, Deb Romero, certified Alexander technique instructor. Sorry, this is a long mouthful. Alexander technique instructor should kind of go together. And of course, Lily's here. Yes.
Hi, Lily.
So today's topic is, and I know we've covered this before, but I think it's still such a big ass deal for people to wrap their heads around that I'm happy to talk about it again. But the topic is straight in horses also means level. And we're going to tuck into what that means because actually Deb and we just looked at
Hmm.
your horse Milo and
Right?
recorded the remote lesson. It's up on YouTube if you guys
Oh,
want
you
to
guys
watch
should
it.
watch it. Yeah. The
Yeah,
conversation is fantastic.
so my YouTube channel is at Kirsten Nelson, all lowercase. And I know the spelling's not easy, but what do you
It's all
say?
E's. It's
Yeah,
all E's.
it's
That's what I,
KI and then all the other vowels are E's. So
all the
it's
other vowels are E's, no
yeah,
O's, because
Kirsten Nelson, one I, all
Nelson.
E's. Yeah.
Yes.
So, anyways, your lesson will be up there sometime today. So by the time the podcast comes out on Saturday, it will be there.
Ah.
Yeah. So, st what, like straight on a circle, make your horse straight, track straight. We hear straight all the time, right? Or make the horse straighter. And the one piece that is not in any classical literature regarding horse training or traditional horse
Hmm.
training is the level is part of straight. And we think of straight with a horse nose to tail, but what
Hmm.
level means is the barrel and the hindquarters are not rolling side to side or tilting to one side. And that's related to the spinal function of rotation. Um, but it's not addressed. And so even
Nobody thinks about it. I mean, I don't ever hear that language. Or are they aware of it just riding? I don't know if riders are, because we've been taught, what's some of the language we've been taught? Move with the horse.
right, or keeping your horse straight, it creates a blind spot. It's not that it's
Ah,
not
good point.
happening,
It's,
but
yeah, it's definitely happening because you can see the saddle slipping.
well, that's just it. That's what I
Yeah.
was going to say is we recognize the fact that it happens, but we don't know
Mm-hmm.
why. And so it's that rotational movement of the spine. And so the rib cage is attached to the thoracic spine and connected with the sternum on horses and people. And so the whole barrel, if the spine is twisting, which is the rotational movement of the spine, then the whole barrel is rolling to one side. It's not level under the saddle across the top of the barrel or not level across the pelvis, the top of the hindquarters.
Right.
And that lack of levelness is a huge problem. And so we only recognize it as a problem when we go, why does my saddle always go off to one side?
Or I have my horse won't pick up a certain
Yeah, won't pick up a certain lead,
lead.
is different,
Um,
like is one-sided. One direction is easy,
One-sided.
the
Yep.
other direction is not easy. Or a lot of times, and I've seen trainers do this, they'll shorten a rider's stirrup only on one side. And I go, all that's doing is managing the rotation, which is the root cause or the problem. And so maybe how would you describe rotation? Because it's true, lateral bending and rotation always happen together. And
I
so,
I think the I don't know how to I can tell people, if you don't understand what rotation is, let your horse walk down a hill.
and watch it swing, roll side to side.
Right. Or
Yeah.
feel it. Be on the horse when that happens. Then it's big enough at that point. You go, oh my God,
It
there it
rolls.
is.
Yeah.
So we've got hills here in Virginia, very small ones. So even, three, and then you really have to figure out that that's not okay.
Right.
That
No, and
that movement we've been accepting
so
is
for
not
me,
okay.
for me, I kind of knew about rotation working with an osteopath as one of my mentors. He would mention rotation, but it was like I couldn't quite take the idea into what I
Mm-hmm.
was feeling when I rode, right? And then I had this epiphany moment. I was riding my little Arabian horse Prima, and I think I was bareback and bridleless because something was coming up for some demo I had to do, and I hadn't ridden her that way in years. And so I popped on her, and we're just hooing around the yard. And I went to turn, and she wouldn't quite turn. And what I would normally do is I'd carry a riding whip and I would sort of push the outside shoulder
Mm-hmm.
over.
Right?
And for some reason in that moment, I paused and didn't automatically use the riding whip. And I was like, well, maybe my seat needs to do something different. And all of a sudden, I felt her whole barrel roll like a big giant exercise ball that was going the wrong way. And I go, that's why the steering is hard.
That the steering goes away.
The steering goes away. And I was
And
like
what's that other phrase? Oh, I'm going right. I'm pulling with the right rein and the horse is going left.
drifting left. Yes.
Yeah,
Yeah. Yeah.
that
Again,
one.
that's rotation.
That's
Not
rotation.
not being able to turn is a rotation problem, right?
Mm-hmm.
Turning too much, falling in is a rotation problem.
A dropped shoulder, a
Yeah.
dropped hip, all of that stuff. And you can see it if you look, especially jump riders, if you watch them around the course
The
and freeze.
motorbiking.
Yeah,
Yeah.
motorbiking.
Motorbiking is also a rotational problem.
Yeah,
Yeah.
so it's everywhere.
Once you can see it, you can't not
You,
see it.
yeah,
You can't unsee. Like once you recognize, it's a little shocking how many horses, even at very high levels of competition,
exactly.
are overly rotating the spine. And so I had a client who wanted me to really break it down, and I'm going to try to describe it verbally because we're on a podcast, but I used my hands in the moment. So I kind of made two little fists, and Lily thinks that means it's time to pet her. And I went, if we think of, if we make two little fists and think of those as two vertebrae, right? Lateral bending would be extension and flexion between the vertebra. I
Mm-hmm.
know you're not helping right now, Lily. Why don't you go there? And so it's a space, like extension just means that the bones on either side of a joint, the bones are moving farther apart. Flexion just means the bones on either side of a joint are moving closer together.
Right,
That's all it means, right? So lateral flexion is lateral bending, which means on a left lateral flexion, the vertebra bones are moving closer together on the left side of the spine.
right. That makes sense.
Yeah. And on a right lateral bend or right lateral flexion, the bones of the vertebra are moving closer together on the right side of the spine. But the spine is 360 degrees. It's
Right.
three-dimensional.
It's not
It
linear by
it's not
any
linear.
means.
So the very same vertebra at the same time, if we're creating too much flexion, bringing the vertebral bones too close together, say on the left side, those very same bones can also roll or wrap around the spinal cord. So rotation is a twisting motion where the same bones, even as they're flexing or extending on the left and right sides of the bones, the entire bone can also roll
Right,
around the spinal cord. That's rotation. So when we have use the traditional idea, right? Because rotation, it wasn't really factored in, even though it's always happened. It's always
oh, it's
happened,
always been there. Yeah.
right? And some of the classical masters would talk about keeping the horses upright or keeping them
Uh-huh.
square. Those were sort of the words that were used, but not like level. I like the word level because it's a more accurate description. You don't
Hmm.
want the bones rolling around the spinal cord or twisting around the spinal cord. And so, as soon as lateral bending becomes excessive, it causes that rotational movement of the vertebra at the same time. So, the old concept of bend your horse's midline like a banana is causing rotational movement of the entire barrel and a tilting sort of
Right.
lower on one side, lower on the other of the pelvis. And
It's
that's
causing a dropped shoulder, dropped hip, whatever. It's causing that.
it's causing the saddle to slip.
Yeah,
It's causing the horse to not steer easily.
right.
It's perpetuating a dropped back,
Exactly.
right?
It's a no, yeah.
And when we talk about a three-dimensional body, that's the other thing. Like lifting the back and dropping the back is a upward, downward, vertical movement of the spine.
Hmm.
But at the same time, it can still flex and extend laterally, and it can still rotate.
Rotate.
So it's all the same bones, but if you think of the range of motion, which is pretty minuscule, really, which is what
Hmm.
tells us the spine should be stable, is even though these joints can move in multiple directions, the tiny little restricted range of motion says they shouldn't move very much.
And the reason that is because the spinal cord's in there.
Mhm.
You don't want a lot of movement because you want to
Around the
put
spinal cord, right?
around the spinal cord. It's
That
just
would be
anatomy. It's just
exactly.
basic anatomy. That's why it should not move that way. And that may be why certain horses act out,
Oh, yeah. In fact, I get asked all the time about behavioral problems, and the reason
right?
I often want to see the horse, not just sort of talk about behavioral problems in isolation.
Right?
Behavioral problems are also going to coincide with movement issues or
Right?
performance issues, and you can't separate dysfunctional coordination and bad behavior. They go together.
I totally agree with you
I
on
go,
that.
it's one
It's a
system.
signal. It's a signal that something's not right.
Exactly.
Hmm.
And so, like in our body, I'll describe to people, I go, lateral bending is like sideways bending, right? We bring our ribs closer together on one side and they stretch apart on the other. And then rotation, the ribs don't come together at all. It's just a twist,
Hmm.
right? So
You stay
rotation,
tall and it's a twist, right?
right? It's a twisting motion of the spine. And not all segments of the spine have the same ability to twist. Some can twist only a tiny little bit, and others can twist a lot. So it's the same for a horse, like where most of the lateral bending and most of the twisting can happen is right under the saddle between
Right.
T9 and T16. And so that's where you have more mobility. And if the rider is moving with the horse,
Oh, there you go.
right, the force of motion, it's like, what was it we
This,
talked about? Newton's laws of motion
yeah,
yesterday in our meeting, and it was
yeah.
like, yeah, if a force acts on an object, because force always has magnitude and direction, how much force and where's it going?
Hmm.
And so when a force hits an object, that object is going to go the same direction as the force, or it has to resist it.
Exactly.
So when we move with the horse, our mass, right, and typically our body weight too, is going the same direction. The horse is pushing us.
The
We're
same
pulling us.
problem. We're just exacerbating
Exactly. We just
the
make the
problem.
problem worse,
Yes.
right?
Therefore, we have a horse that'll probably eventually act out or go lame, or
Right. And
if,
our old-fashioned traditional concept of laterally bending the horse's spine was based on the belief that every vertebra flexes the same amount between the horse's head and tail, and it doesn't. right? We might have to pull that research paper up again
We
because
That's an old one,
I
but
know Jean-Marie Denois
we
really
need to
like,
go over that one again. We did that like podcast number 20.
I know, I know. It gives us a chance to geek out again to
I
review
know, right?
papers. But it's like, no, as soon as you have excessive lateral bending, it has to cause rotational movement of the vertebra or the spinal cord would be damaged.
Exactly.
Yeah. So it has to be. So that rotational movement is so that when the spine bends too much, the bones roll
Roll
around
instead of breaking something.
instead of letting something break. Right.
Yep.
Right. So that ability to rotate the bone around the spinal cord is a protective mechanism. And it's another direction of movement. And our concept of lateral bending in horses, inside leg to outside rein, or how you do a shoulder in, shoulder four, or even straight on a circle, all of that is excessive lateral bending, which is
Yes.
causing rotational problems in horses. And then we wonder why we have to get our saddle flocked asymmetrically because the back muscles are
Oof.
developing asymmetrically. We need a custom saddle because our horse's back is so screwed up, right? Or we're injecting, like with Milo, your horse, right?
Right.
They injected what? It was a list.
It, he had like 50 some pages of vet bills of injections, SI joints, hips, hocks, stifles, neck,
Yeah. And
all trying to, which they're not looking at where the problem is beginning.
right,
They're looking at the repercussion of what the problem is doing.
right.
Yeah.
And I think that's very typical. I mean, it's basically how medical professionals are
They're
trained.
trained. That's
Yeah.
how they're trained is when you say your horse is lame. I don't know. I see some body workers posting online to go to the spine to look at spinal movement
Mhm.
instead of looking at leg movement if there's a lameness.
No, and that was the problem with Milo because the visual effect was just this slopey hindquarter that
Hocks under,
the
capped
hocks
under.
constantly bent, camped under a
Yeah.
little with the
Mm-hmm.
legs. And some people would say, oh, look how engaged he is because the hind
Oh,
legs are
they loved
so
that. They loved his
close to
movement.
the
And I would be
center.
going, oh my God,
Something's not right.
it's not right.
And again, and then I think right before I saw you, your osteopath had been there and said
Mm-hmm.
there's no pain issue, there's nothing wrong with him mechanically. He got 100% all clear,
Yep.
things are good. And yet he was still moving. I call it like a dog walk. Like you know how some
Yeah,
dogs,
that's a good way to put it.
yeah, it's kind of like they have this slopey hindquarter and
Uh-huh.
their legs are always looking a little too
And is
bent.
things just they just don't look right. I don't know how to explain it. The movement just wasn't correct because the stability was not there in the spine.
Yeah, and so you would say he was sickle hocked, he was also cow
Mm-hmm.
hocked, he was base
Yep.
narrow,
Yep. All of
all of
that.
these things, right? And when we watched him, it was only a habit of movement. And
It
this is
is.
where so many like dysfunctional habits wreak havoc in the body. You have all these lameness issues that are just mysterious or what they
Mm-hmm.
technically call idiopathic, unknown cause. And it's like watching him move, knowing about rotation, having developed an eye for rotation,
Mm-hmm.
and that it should not be there. What you could clearly see him do was he rolled the lumbar and the pelvis and
Mm-hmm.
not even the whole barrel, like the
No,
rotation. He
just the
really
lower
just
the lumbar part.
yeah. So in order to swing the hind leg forward, he rotated the lumbar sacrum and pelvis to the opposite
Mm-hmm.
side so that the hind
Yep.
leg could come forward. And then he rotated everything the other direction so the other hind leg could come forward.
Right.
And it made me think because I had a good question about well, why, like, when I'm talking about stabilizing the spine all the time, people will say, well, what about the swinging back? Shouldn't the back be moving? And I said, well, that's exactly what that looks like, is you get a camped under, slopey,
Mhm.
dysfunctional hindquarter that doesn't look right, that's riddled with arthritis in every joint.
Right.
I go, that is the result of the spine literally moving. And so when we think we want the spine to be really mobile on a horse, then the legs have to create stability, which means
Yep.
limit the range of motion of the leg,
Right.
limit the range of motion through the joints, tighten all the muscles that are built for elasticity. And
Yep.
it's
It
like,
happens in people too. I
yeah.
always say the walker effect.
And I think it's kind of a really damaging vocabulary when we
I agree. Our
say,
vocabulary, the changing the vocabulary changes the way of thinking.
yeah, because when we
Yeah.
say, I want a swinging back, I think the first thing people picture is this like cat-like movable
Undulating thing.
unge yeah, and even cat spines don't move. I go, it's they just don't have the same range of motion that it appears to have.
That's a great example because I know there's a video of a cheetah somewhere. But even thinking your regular cat, when they're looking at something to pounce on, they get very long
And
and
straight,
very still and straight in their back so that their leg muscles and bones and joints can move.
right? Because
Same like
and
a deer, the same thing.
right, and until the spine and pelvis are stable,
Mhm.
the hip joint, like the amazing ball and socket hip joint, the amazing ball and socket shoulder joint that attach the appendages to the torso,
Mhm.
that's where the mobility of the limbs comes from.
Exactly.
But if the spine and pelvis are unstable, the first thing that's going to lock down are those ball and socket joints.
And I can attest to it for riders. If you are gripping with your legs,
You can't move the ball and
your
socket joint.
your spine is not stable.
Yeah.
It's that simple.
No, any gripping with the arms, the hands, the
Yep, the
legs, all of
legs.
that,
That's
needing a deeper seat, needing the thigh blocks,
Yeah,
needing the
that's
stirrups,
all
all
lack
of
of
that.
control of Grand Central Station, as I call
Right.
it.
Right. No, and changing Milo's pattern, that was
Mm,
it was a dramatic session to kind of just plant the seed with him. But in the
yeah.
lesson we just did, he's completely
Oh,
changing
you guys have got to watch it on YouTube. It's incredible.
how he moves his hind legs forward is now coming from the ball and socket hip joint rather than the rotational movement of the lumbar
Hmm.
sacrum and pelvis.
Yeah. And
And
the
it's
long lining,
awkward right now.
it's
It's
awkward.
awkward.
It's slow,
It's
but that's
slow and
okay.
awkward, but it's just like
But
if we
he's
have low
repeating
back,
healthy movement.
exactly.
Yeah.
Exactly. And when we have low back problems, issues around the pelvis or the hip joint, we're slow too. Like
Right.
that's an area of the body where once you've developed a pattern, it's difficult to change and it's awkward to change, and everything has to slow down before it can change.
Right.
But it can change because,
Yes.
that's the other thing is like when I mention a slopey hindquarter, cow hocked, sickle hocked, all of that, those are confirmation points. And so I'm sure with all those injections he got, the vets are just saying that's his confirmation. He just is going to have
Mhm.
more wear and tear. He's not going to be as athletic. And I go, no, that's a coordination issue.
It
All of
is.
those are coordination issues, which is a functional use
Right.
of whatever confirmation we have.
And that's like we
I
were
go,
talking before about my x-rays. Everybody thought, and I did because I was having so much pain in my hips that I needed hip replacements. And my hips were just fine. The surgeon said, well, your hips are fine, but your low back looks like shit. And I said, but my low back doesn't hurt. And he said, well, whatever you're doing,
Yeah.
uh, keep it up. But it was a movement issue.
Yes.
It was not a structural issue.
Right.
So correcting my movement, seeing another Alexander teacher, has significantly helped.
Yes.
Right.
And even with Milo, it's the same thing. I'm sure he has hip pain, stifle pain. I'm
Mm-hmm.
sure he had SI pain because SI pain, sacroiliac joint, which is deep inside between the pelvis and the
Mm-hmm.
sacrum, if that moves, it's not meant to move.
Oh, it's so painful in a
It's
human.
so
In
painful.
a human, it is because it's like we've mentioned before, two tectonic plates. It's not a ball and socket or like an elbow. It's
It's two flat surfaces.
two flat surfaces, and if
Hmm.
one is not where it's supposed to be, it's excruciating.
Yeah. Yes, it is. And so that is basically what attaches the pelvic bone to the spine. And so when you can see the hindquarter rolling side to side, that's a tremendous amount of stress on the SI joint. And if the SI joint gets stressed, even before it makes a shift, which is what causes the pain,
Right.
that hip joint is going to try to stabilize the SI joint.
Yep, it's going to lock.
It's going to lock. And so, and I'm sure even with arthritis in there now, it's like you can see that range of motion as he's starting to stabilize the lumbar and the sacrum and the pelvic bones on top. You can see sometimes the leg swings forward from the hip joint, but the top of the hindquarter is still.
Right.
That's a
And
totally different
totally,
organization or
yes.
coordination of how he uses his hindquarters.
And I think I don't know if we mentioned it in a podcast, but playing with the tape, if you
I love
can't
the tape.
see
Hmm.
it, if you can't visualize it, get some contrasting tape
Yeah, like
and
masking
put it,
tape, painter's tape,
yeah,
whatever.
something that contrasts with your horse's color so that you can see what's going on.
And I think I have videos of that too on my
Oh,
YouTube
good.
channel with people doing that. But you basically start at what we call the point of the hip, which is the tuber, and you guys can Google it and look up your tuberosities so you know the points on the horse. But the tuber coxae is on the side of the hindquarters. It's the big,
Mm-hmm.
almost
Big
C-shaped
bump.
bone that we can feel, and we call it the point of the hip. And the tuber sacrale is the bumpy bone we can feel at the very top of the hindquarters. And then the tuber ishii is basically the horse's seat bones, which you can feel through the hamstring muscles on either
Right.
side of the tail. And if you just connect those 3 points with some strips of tape, you can start to develop your eye for is my horse's pelvis stable during motion or is it moving a lot? Because
Mm-hmm.
before the SI joint moves enough to create pain, those pelvic bones move,
Right.
right? So that the joint can stabilize and the hip joint locks, right? So then the movements kind of come in through the bones themselves. And more, we see it more on the lower half of the pelvis or the side of the pelvis. The SI joint's kind of at the top of the pelvis. But the bones moving is stress on the on the SI joint. And then the hip joint locking is going to change the flight path of the
It's
hind
kind of like
legs.
you, it was so funny when you were here. We were trying to duplicate as humans how he walks.
You know what? I
That
almost mentioned that because,
that is
like, I don't know if you do that, but I'm such a kinesthetic learner
I am too.
that I actually, when I can't quite, when I see something that I'm like, that just isn't right. Like,
I don't know what it is, but let me duplicate it.
well, and I wish we would change the vocabulary of the swinging back to swinging movement.
I
I go,
like that. Swinging
swinging
movement.
movement is
It's
the result of good mechanical
fluidity.
use.
It's the
Yeah,
fluidity. Yeah,
because you get more power, you get more suspension, you get more ease of motion, you get
right.
all the shock absorbing functions of the leg joints. Like it's just gorgeous. So swinging movement is what I would call it when the balance is good, not a swinging back, because that gives us a bad
That's
impression.
an isolation factor, which
Hmm.
that's not taking in the whole horse.
Yeah, and we even describe back movers and leg movers, and it's
Yep,
like a leg
we
mover is
talked
not
about that.
good, but it's that kind of vocabulary that gets us to
Hmm.
focus on the wrong thing or look
I
at things the
agree.
wrong way. Because we should have legs on a horse that swing freely. If you think of the ball and socket joint, if the midline and pelvis are stable, then that increases range of motion through the ball and socket joints, which means it increases range of motion forward, back, and even adduction, abduction of all four legs. So we get swinging movement, right? And what
Full
a
range of motion. It's all available for full range of motion.
Right. But we call that a swinging back and we call that a
Hmm.
back mover. And what a real back mover or a swinging back looks like was Milo. I go, his stiff little ugly strides where they either are a little pumped up on adrenaline or a little bit, snarky and don't want to move forward. I
And
go,
he
that,
was all of that.
yes,
He started with pumped on adrenaline, then he went to no go,
right.
and now he's at, oh, I think I really need to think about this.
Yeah. And
Because
you
you
would
can,
think that, like, with the arthritis, the injections he's had, that he wouldn't enjoy, that he would resist using the hip joint, the stifle joint, the hock joint. And they don't. Like,
no, they don't.
even if and I discovered I have horrible arthritis in my big toe on my right foot, right?
Mm.
But when I put weight on that toe and I use it the way it's supposed to be, I go at first it was a little uncomfortable, but not bad, right? But the little bit of discomfort meant unconsciously I used it less and less.
Well, and
So,
it's even like you said, it's the language and the words we're told.
mhm.
Because they found arthritis in my hips, but that was not my cause of pain.
Oh yeah, they found arthritis in my shoulder, but that
And
was not
I
my
had no
cause of pain.
pain in
Hmm.
my back either. And they're looking at my back, and I'm looking at it. It looks like a jigsaw puzzle. I'm like, geez Louise, Deb.
Yeah. No, I like the words rusty joints, which
Rusty joints,
it
that's
just
too
means
funny.
arthritis. The joints got a little rusty, but it doesn't mean even with arthritis, even with x-rays never changing, you can still restore comfort and
I agree.
mobility to that area. And that's, again, people don't think that's possible. And I go, I've done it myself. I've done it
I
with
have
hundreds
just,
of
yep.
horses.
I just went through it again with this quote unquote hip pain and
Hmm.
went to actually an Alexander teacher that specializes in walking.
There you go.
It was all about my walk.
Yeah.
So
Yeah.
pain
And it's
gone,
and it's the same with the horses, like
right?
even horses that are lame at the trot, the canter, or unsafe to ride. I go, changing coordination doesn't matter what speed you're at because ideal mechanical coordination is the same, whether it's walk, trot, canter, left, right,
Right.
or jumping or barrels or whatever you're doing. I go, it's the same coordination. So that's the good news because you can work with horses remedially and make significant changes to their patterns that made them lame or uncomfortable or anxious or out of control.
Mhm.
And you can change those patterns with very slow work, very gentle work, and ease the body into a new coordination, no matter the conformation. I go because
Exactly.
conformation to me is like kind of the size and shape, whether you got more slow twitch, more fast twitch muscles, what your genetic
Exactly.
tendencies are, that kind of thing. I go, okay, that's unchangeable. But everybody has a hip joint. Everybody
Everybody
has a
pretty
thigh
much has the
bone.
same skeleton. We've got the same skeleton to
We've
work
got the
with.
same anatomy.
Yeah.
I go, and
It's just
even,
how our brain tells it to work.
right. That's coordination.
Hmm.
Yes, yes. And I think we're still on track with our topic about straight equals level. But it's that unawareness of
Exactly.
a horse being unlevel. And the quickest way to feel it when if people just look at me and have no idea what I'm talking about is I go sit on your horse at halt,
Mhm.
take one rein, and bend the neck really far, like you're suppling the neck, bending the horse, whatever. And as soon as you bend the neck, say to the right, and you're sitting on the horse, you're going to notice you and the saddle and the barrel all roll the opposite direction. So the
Exactly.
barrel will become lower in the opposite direction of the neck bend, especially when the neck bend is excessive. So all of this neck flexing back and forth, I go, all you're doing is creating rotational movement
You're
through the
destabilizing.
destabilizing the back and
I
hindquarter,
agree.
causing tension around the spine, in the
Yep.
core muscles, around the SI joint, all of that, and stressing the legs. I go, it's not suppling anything. All it's doing is over flexing the neck and creating problems further back.
I agree.
But I do use that. And I go, if a horse is terrified and I need to make a turn to get control over a
Well,
flight
that's
path,
emergency procedure.
I go, fine, bend the neck, do what you have to do, but it's not my
It's
normal part of training.
not routine.
And I'm not ever mixing it up with the idea that it's yoga for horses. I go, it is not a suppling use of the neck, at least not to the back and hindquarters. It might supple the muscles in the neck,
Actually,
but it's going to tighten up the back and hindquarters.
yeah, actually, straight and level is suppling.
Straight and level is suppling because
Yes, because
for
everything's functioning properly.
because the chronic excessive muscle tension is there
Hmm.
because the bones are not stable where they should be.
Right.
And you can't massage that away.
No,
You can't do carrot stretches to
and
get that to go away.
that's when I about 10 years into my massage practice, that's when I decided I needed movement, functional movement, because people were just going out and re-injuring themselves or doing the same thing.
Or repeating the same unconscious habit of movement.
Exactly.
So coordination is nothing more than a neural pathway. It's a
Exactly.
habituated way of organizing the anatomy that
Got to
has
change your
become unconscious,
update your software, people.
right? Update the software before it
I
gets
just
too
had mine
glitchy.
updated a couple days ago.
Yeah, so like Guinness, who I was working with, right? He has an 8-year-old horse that has such severe hock arthritis that the one hock is fused and the other one is fusing, and there's swelling on both hocks. Then he also has um, sort of tendon strains just above the fetlock on the right front and a
Oh,
high suspensory strain and swelling on the left front. So lame on all four legs, right?
and
Very anxious. And when I started working with him, there was a muscle so tight along his lumbar, more on one side than the other, that it was a bump.
poor guy.
And when I palpated it, it wasn't hard, like what we call a roached back, which is an
Hmm.
arthritic spine, is what that is. But it was muscular, but it was rock hard to the point you could see it, like it was a little bump on his back muscularly. And just working with him on the long reins, which is specifically the way I do it, addresses that rotational movement and minimizes it, starts to stabilize and take away any sort of tilting or rolling of the pelvic bones first, and then works its way up to the lumbar and thoracic. And even before his movement, like the first couple times I worked him on the long reins, he did not know what to do with himself. He was coming out of his skin because he was like, what do you mean I can't move that way? I don't know how to move, right?
Yep. It
And
happens in
so,
people too.
yeah,
They kind of blow a cork.
yeah, and it was only really the first session, maybe the first two. And then he started to feel how the stability was helping him. And he got very quiet and very cooperative on the long reins, like within two sessions, even though I knew that was going to be difficult for him. And within, I want to say, the first month of regular work, just reducing that rotational movement through his barrel and hindquarter, that lumpy muscle went away. It softened up and
Mhm.
disappeared. And I go, that lumpy muscle was there, that super tight muscle. And he's had body work, he's had massage therapy. It's still there because every time you release it in a static therapy, as soon as he moves, it comes back,
Right back. Yeah.
right? And like with Milo, there was nothing mechanically wrong with him. He wasn't
Mm-mm.
sore, he wasn't tight, but he still moved that way.
Right.
That was just how he learned how to move. God knows why, but that was how, right? And so, like with Guinness, it was just so fascinating because he was kind of extreme to just watch that that muscle disappear at the same rate that his barrel rolled less and his pelvis rolled less. That muscular suppleness or that the tightness didn't need to be there
Hmm.
anymore. So
Right.
the body just lets go.
Yeah.
And so keeping the horse's midline and pelvis not only straight nose to tail, but absolutely level across the body left to
Hmm.
right. I go, that's what makes the top line supple. That's what restores the mobility to the leg
Right.
joints. That's what releases all that chronic shortening, tight contraction of short necks, tight backs, asymmetrical backs. Um,
If you're not using it properly, something is going to tense. It's that
has to.
simple. That simple. In a
Yeah,
human, no matter what.
because bodies have deep, deep, deep programming
Exactly.
that says don't fall by any means necessary. Don't
Yes.
fall. And so I was trying to describe dysfunctional coordination, and I go, you know what it really means? It means that the wrong parts of the body are being used for stability
Yeah.
mostly,
We've talked about this, the
so that we don't
stability,
fall.
mobility muscles.
Right. Coordination should be equal parts stability and
Right.
mobility. But if the parts of the body that are designed to be stable are mobile, then the parts of the body designed for mobility have to restrict mobility for the sake of overall stability, not falling.
Exactly.
So, so you guys can try it. You can tape up the
Yeah.
pelvis and see how much it moves. And
Yeah.
then
Even
people
just
go,
tapes across the top, if that is all you can get done. And,
yeah.
keep it simple.
No, and I go, it's so funny, but even books I've looked at and people have shown me, there's well-educated horse people perpetuating that the barrel should roll, that the pelvis
I
should
don't know
tilt.
where that came from.
And maybe because that's what all the horses did,
Oh, so it was acceptable.
so it was considered
Maybe.
normal, right? But oh, fun fact, right? It kind of reminded me of, the reason that the average temperature of a human is 98.5
Mm-mm.
is because when that average was done, it was, I don't know, near when medicine was first being developed, whatever
Okay.
era that was, right? Just past the Dark Ages, I guess the Renaissance era. But it was because so many people, like we died at a younger age, that so many people had chronic inflammation that that was the average temperature.
Oh,
And
get out.
no, and our modern new standard temperature is like 97,
See, and this is what's so amazing about words
right?
because my temperature has always been like 97.4, 97.6, and I
Yeah.
thought that was bad.
And we're talking Fahrenheit too for you
Yeah.
guys who are in Celsius, but
Yeah. And I thought
Um,
something's wrong with me.
no, and I was always told your temperature runs a bit low.
Oh
But it's
God,
like,
help
wow,
us
even
all.
even something as solid as we think is,
Is
a normal
not.
temperature,
It's not
it depended on kind of the collective
some
level of
made
health
up
at the
thing.
time,
It's too
right?
funny.
Yeah.
Oh well.
No, and then I also read an article like there's so many people being put on statins now
Oh, don't get me
because
started.
they changed the criteria of what was normal and they moved the window, right? So they moved the window, what used to put you in a normal window, you didn't need
Hmm.
statins. Now you're in the window where you need them. And all they
Welcome.
did was move the window. Like,
Yeah, don't get me started.
yeah, yeah. So that's why I think, and a lot of people resist, like I get all kinds of pushback when I
Hmm.
start talking about the barrel should not be rolling, the pelvis
Hmm.
should not be tilting. You need your horse to be level. Ooh, ooh, not only on a circle, but during all lateral work.
Good point, because
During
I see
all
that's the
lateral
worst
work,
where
that is where
I
it
see the
happens the
human.
most.
Yeah, I see the human actually fall into it because the thought is
Bend, bend, bend.
bend, bend, bend. So therefore the human does the same thing.
Yeah.
Yep.
And actually, the definition of correct lateral bending is the amount the spine can bend without inducing rotation,
Oh, please.
right? Which is not very much. It's
No, I
nothing
think
like what
people
we're used.
don't know
No, they don't know.
anatomically by how that works.
Yeah,
That's probably the thing.
yeah. And we have a massive collective blind spot for unlevel horses.
Good
Massive.
point.
Yeah. And so a lot of horses, just like your horse Milo, if they're bending a lot because we're trying to make room for the inside hind leg to come deeper,
Oh, bother.
right? That's the inside leg to outside rein. Straight on a circle means your horse feels like a banana. All of that does cause the hind leg to step deeper towards the center, but it steps towards the
The
midline.
midline.
It
Yeah,
loses
for
squareness,
for stability. It
right?
has to.
So then you've got your stifle and hock and fetlock that are really designed only for forward back motion.
Hmm.
Now you've got all those oblique angles of the leg, and you're basically
That's not meant for
creating
that.
shearing forces through the joints. And so those shearing forces are what create the arthritis. The bone's
Right.
just trying to stabilize because the leg should not be in towards the midline. It should be behind the front leg.
Right.
So
Straight and
crazy.
level.
Straight and level. If nothing else, you guys,
That's
develop
it.
your
That's the name of the
eye
game.
straight and
That's the name of
level.
the game.
And I kind of coined my own phrase for training purposes, and I call it internal straightness,
Yes.
right? Internal straightness basically means a broomstick straight line of force, nose to tail, because that is the healthy alignment of the spine. And then a broomstick straight line of force across the top of the barrel, front, middle, back, and across
Yep.
the top of the
The entire
hindquarters.
spine,
Hmm. Yeah.
just
So,
like in the human. Same thing.
yeah. And then people go, well, how do they turn? I go, we'll circle back to the ball and socket joints,
We'll go back. We'll
right?
do another podcast on adduction, abduction.
Yeah. Ball and socket joints can move all directions. I go,
That's your
so
lateral work right there.
exactly.
Right.
Exactly.
We'll talk about that another day.
Yep. I think we better wrap it up. We've been yapping for an hour. I think we covered our topic with lots of little interesting
Now,
side
hopefully, we
roads.
get some feedback.
I know. Thank you guys for joining us. And thank you for liking, sharing this podcast, subscribing, all of that stuff. And we welcome your comments, welcome
Yes,
your
we do.
suggestions, and any topic that you have questions about.
Hmm.
We're happy to dive into, even if we have to do research. Ooh, gives
We'd
us an
love that.
excuse. Love research. All right. Thank you
All right.
guys.
Thanks, everybody.
Bye.
Bye.